senior fellow at the Heritage Foundation. Kevin, let's start with this mask issue. This has become such a politically charged issue here in the U.S. So I want to take a look at Europe for a second. The EU issued guidelines saying that masks should be worn while traveling. A lot of those countries are also encouraging people to wear a mask outside in some public places. Sweden, though, apart from travel, is an exception to this because they're saying face masks don't provide any greater protection to the population. So when you look at what California is doing, based on the science, are they going too far here?
Based on the science, I would say maybe not, because anytime that you have a respiratory virus or a respiratory illness and then it spreads by respiratory droplet, then putting a covering in front of your face is going to help prevent the spread of disease. However, that's, scientifically speaking. From a public health perspective, though, what you really need in any kind of measure, any kind of mitigation strategy, you need public cooperation. And this mandate, I don't know how they're going to enforce it. If they're going to actually send law enforcement out and enforce this rule to wear a face mask outside. If they do that, then I think there's going to be a lot of loss goodwill from the public. I mean, I think that there's already a lot of credibility loss as far as public health measures go. So it is good to wear a mask if you're in a public area with other people and you can't avoid intimate spaces with other people. But to have a blanket requirement at all times, that goes way too far, because if you're outside for a walk, for instance, wearing a mask is not going to protect anybody. It's not going to do anything. So there are places where a mask would be helpful, and there are many places where a mask wouldn't be helpful at all.
So what about the argument that a mask is just another way to reinfect yourself? Because every day I see people touching the outside of their masks, adjusting it, pulling it down around their chin. If in fact, and I've spoken to doctors about this, the virus lives on the outside of the mask, isn't there a greater chance of reinfection?
It's not going to be easy to reinfect yourself if you're already infected. You're not going to get a significantly larger dose of the virus, and you're not going to get enough of the virus to become sick if you're wearing a mask. That having been said, I'm assuming that people with reusable masks they're wearing all the time. If you're wearing a disposable mask, that you're changing it out at least once a day or at least once every few uses, so long as you're not wearing it all the time for long periods of time. This is something that we had to do in the healthcare field in the early stages of the pandemic response when there was a shortage, but that was understood to never be an ideal situation. So long as you're using a new mask and you're washing it or you're disposing it and using a new one pretty frequently, you're going to avoid a lot of that situation. And that is true that a lot of protection is lost if you're going around touching things and then touching your face, because a mask can't prevent you from inoculating yourself using your fingers. What they do, however, is if you have the virus and you don't know it, a mask will prevent you from spreading it to somebody else. And that's the main thing, is what you're actually doing with wearing a mask is not protecting yourself, but protecting the people around you, protecting the people in front of you. And that's one thing that we should be clear about as far as the efficacy of a mask goes.
And Kevin, just one last thing before we have to pivot to some other news. The states that we are seeing a new spike in cases, do you notice any sort of trend about the way these states have reopened and maybe why these particular states are seeing an increase?
It's a little bit difficult to say because different states have opened up in different ways, and yet we're seeing a general rise in the number of cases. And there is a difference between the actual rise in cases and the percent positive. So a lot of states are doing just significantly more testing, and as a result of that, they're showing more cases. That doesn't actually tell you the trend, but some cases, I believe Florida, the percent positive has been increasing over time. It hasn't been increasing by too much, but the increase is concerning. What I really think explains this is is getting warmer. People are starting to go out more. People are starting to trust the outside world a little bit more. And so as a result of that, you're going to get more cases. Just as we resume normal activity, this was always going to be a risk that people could take. That having been said, most of the people who are going out, the people who are more or less fearful of going out, they're usually of the lower risk cohort. So it's generally going to be a little bit safer. And what we saw was that we never exceeded hospital capacity. So these rising cases, it is concerning, but it is something that we've seen that we're going to be able to handle. So I think this is going to be okay.
Great points. Kevin Pham with the Heritage Foundation. Appreciate you coming on.